And good morning to everyone today. Thank you for joining and ready to walk through some key controls and best practices for staying informed and compliant. We're going to start by talking through some operational challenges that can affect our key performance indicators. What is a reactive and a poor food safety culture? A few key performance indicators of health inspection performance and guest satisfaction. And we're also going to look at some practical data sources to find this information, risks that we may have, and ending on what is a strong food safety culture. Let's talk first about some food service industry operation challenges. We know that these are the reality within food service: high employee turnover, a complex supply chain, time and resource constraints, emergency crisis, challenging and changing regulations, costs and efficiency pressures, and social media exposure. We know that in the industry, the employee turnover average is 155%. It takes a lot of time and resources, up to $6,000 to replace one hourly employee, and we know how important training is. When we walk through where we are today, and you think about your own operation, are we acting reactive or are we acting proactive? We look at how this affects the culture within the restaurant. A reactive culture would have a poor food safety culture. Two key performance indicators that we'll talk about today that have to do with the reactive culture are critical and repeat health inspection violations and high guest complaints, which could lead to high social media exposure. So we'll start with health inspection performance. We see here the contributing risk factors to foodborne illness brought to us by the CDC. This shows us that of confirmed cases of foodborne illness, when there was a source identified, 27% were attributed to improper holding time and temperature, poor behaviors of keeping food between 41 degrees Fahrenheit and 135 degrees Fahrenheit for more than 4 hours. Poor personal hygiene contributed to 25% of foodborne illnesses. This can lead to employees not washing their hands properly, come from coughing or sneezing on food after without washing their hands after, scratching sores or working sick. 13%, the risk factors, cross-contamination. We talk about transferring microorganisms from one surface or food to another surface or food, and inadequate cooking attributed to 14%, not cooking food to the recommended internal temperatures, or we go to unsafe source, which is 15% risk factor, which food could be from unapproved and unsafe sources, not buying from approved or regulated food suppliers. Foodborne illness, it is estimated that foodborne diseases can cause approximately 48 million illnesses, 128,000 hospitalizations, and 3,000 deaths in the U.S. each year. Foodborne illness in the United States is a major cause of personal distress, preventable illness and death, and avoidable economic burden. The annual cost of foodborne illness in terms of pain and suffering, reduced productivity, and medical costs are estimated to be between $10 to $83 billion. And the occurrence of approximately 1,000 reported disease outbreaks each year just highlights the challenges of preventing foodborne illness. We see here that 70% of foodborne illness outbreaks begin in a food service kitchen. On average, the cost per outbreak is $75,000. And of those 48 million illnesses, it leads to 1 in 6 Americans that get sick every year. The regulations on the FDA food code are tied to health inspections. We see here a map that shows the food code adoption by state. The regulations are led by the guidance of the food code, and our health inspection standards align with that code. The FDA food code is a science-based approach to preventing foodborne illness. The results can give us insights to food safety and to sanitation behaviors. We know that corrective actions should happen, but they should also be sustainable. These documents are public information, so poor results can put you at a higher risk of foodborne illness and a higher risk of negative results associated with an outbreak. The most recent code released in early of 2018 was the 2017 Food Code. The industry segment that this code covers, or all codes cover, consists of more than 1 million establishments. The Food Code is a model for safeguarding public health and ensuring food is unadulterated and honestly presented when offered to the customer. It represents FDA's best advice for a uniform system of provisions that address the safety and the protection of food offered at retail and in food service. This information can be very helpful when you're looking at standards within each community, within each state. When we look at staying informed and regulation updates, here we have some, not all-encompassing, but 8 changes and updates within the last year to the previous map. Colorado has moved to the 2013 Food Code. You see that Minnesota moved to a new code in the year of 2019. Massachusetts just adopted a new code, and down the line with Connecticut making changes in July of 2018. Again, this data is important when we're looking at systems in place and keeping up with the compliance and regulations within your own states and communities. If we move on to actually look at the trends of health inspections, we see here a 4-year trending of food service critical violations out of compliance. Food contact surfaces, which we know accounts for food contact surfaces that allow for about 27% of foodborne outbreaks are trending year over year. We see in 2015 to 2018 that trend has gone up. And we also see that trend down the line. Personal hygiene, hand wash sinks stocked and available, cold holding at 25% of risk factor, and then continue on with hands properly washed and proper eating and drinking of employees. Turnover and difficulty to train may attribute to this, and it's important to track these health inspection trends. Great practices and building a good working relationship with the jurisdiction can help. Following through on walkthroughs, taking notes, and communicating positive observations and areas of improvement during the health inspections are a good practice, and take action, making changes to systems that are sustainable with corrective action. But we will walk through every critical violation on the slide. We look at keeping food contact surfaces clean. There are different ways to measure clean, and food contact surfaces cannot be sanitized unless they're clean. We know that 13% of the foodborne illness outbreaks were the root cause where contaminated environment played a role. Proper hand washing. In 25% of foodborne illness outbreaks where root causes identified, poor personal hygiene played a role. We know that it plays a role, but do we know why workers don't wash their hands? We know that there's a study published by the CDC where questions and data regarding working ill was collected from 426 restaurants. In this, we found that potential barriers to hand washing were too busy, hand sinks out of sight, soap and paper towels not available, wearing gloves can create a false sense of security, hand hygiene is not always considered a priority, and the connection between hand hygiene and foodborne illness may not be understood. Some claimed an irritated skin due to frequent washing. This information can be very valuable when we're training and looking at showing people how to wash their hands when we know why they're not. So, we get to that point. We have seen this many times, I'm sure, and we look at the acts of washing your hands and thinking, I know this, I've seen this, but do we ask ourselves, how are we doing it? Have others seen this? Are you teaching it? Do you know if others are doing it and if they're doing it right? Very important on seeing the data, using the data, and putting it into action. Cold holding was another opportunity that's trended over the last 4 years, and 27% of food illness outbreaks where the root cause is identified. We see that improper temperature holding played a role. Keeping TCS foods in cold holding at less than or equal to 41 degrees Fahrenheit is a huge role here. Behaviors that can attribute to good and best practices in cold holding are making sure that you have a properly calibrated thermometer. Placing food into cold holding units should be cold. Those holding units are meant just that, to hold product, not to cool them. It's important to pre-cool the equipment before you use it and have effective ice baths, adequate ice, and replenishing as needed. Do not place the product out for service too early. Many times we see that someone will come in, take product out of the walk-in or out of an area, set it out, and get ready to put it away. Should be done before service with shortest time as possible and put away immediately. Close covers before opening and during non-peak hours, and do not overstock the containers. If the containers are filled above an ice bath, it's not going to hold that temperature. We also talk about utilizing equipment properly, having equipment at the correct temperature setting, no unobstructions of the airflow that would have overstocking or blocking the internal fan. Again, use equipment for holding, not cooling, and replace any broken coolers and damaged gaskets. Monitoring and corrective action is a huge, huge part of correcting, and continuous electronic monitoring is used in some cases, and if not, daily walkthroughs, a minimum of twice per day can be used. As we move on, we talk about guest satisfaction as a key performance indicator. The connected customer. People are connected through many channels across all ages, and information is shared fast and it's shared often. We see that the average time spent on social media per day is 347,222 minutes on Instagram. On average, we sleep 6.5 hours and spend about 28 minutes texting. All of this information and ways to share data are important. We look at the power of social media. A 1-star increase in a Yelp public rating can increase revenue by 9%. 71% of people are more likely to purchase when referred by social media, and 72% of customers say reading a positive customer review increases their trust in the business. A dissatisfied customer will tell an average of 15 people about their experience, and 13% will tell more than 20. Knowing the top priorities for consumers in selecting restaurants is important. We look at the most important factors you consider in selecting the restaurant you visit most. Food quality is the highest at 62%, and we go down to drive-through and order pickup at 3%. But when we talk about food quality, it doesn't include everything below with price, variety, and location, but we do know that it would include a poor experience because of sanitation, pests, if someone gets ill, and will they be back? Guests have high expectations. It's important that we look at all areas of the restaurant. Safe food served from safe sources. Approved suppliers and sources should be used for all equipment and food. SOPs should be in place for hand washing, no bare hand contact, not working when employees are ill, proper cold and hot holding, cooking food to the correct temperature, cooling food properly, and cleaning and sanitizing are all important for safe food and safe sources. A clean dining room and bar area are of utmost importance. Showcasing sparkling clean glassware and silverware and having bright clean windows, mirrors, and lights can make a huge impression. Dusting chairs and baseboards regularly to avoid a dingy-looking dining room, and properly cleaning and sanitizing tables. Clean and dry floors with a fresh scent and reducing slip hazards are also important. Clean restrooms are very important to our guests. Keeping floors, walls, ceilings, fixtures, partitions, everything in the restroom sparkling clean and odor-free are very important. Provide an accessible, fully stocked hand sink with soap and paper towels. We know that's a must. And as far as guest service goes, uniforms and aprons are typically front and center when greeting a table. Keep them sharp and keep them clean. Servers, bussers, bartenders, and managers should wash hands properly and at the right times, especially after bussing tables and before putting on gloves. It's important to have a pest and odor-free environment. Clean drains and floors eliminate areas for rodent entry. Keep outside dumpsters closed and the area clean. Very important to have a pest control program in place. There are data sources that we can look at when we're gathering this information. And we know that it will tell you, but how do you react and use these insights to improve? There are public-facing and internal-facing sources. Health inspection results can be gathered from the health department itself. And they come in to your restaurant, they make their visits, and it also can be found on the website. The public will also tell you how you do on most recent health inspections. Many times the results will be posted on the door or in a public area. Again, we know that people will tell you this data source, but how do you react and use these insights to improve? Social media has become very popular with sharing information. Yelp, as we know, publishes this information, and health departments online, and crowdsourcing websites are popular. Guest complaints also give you good data into your key performance indicators, such as foreign objects in food, which can attribute to approved suppliers, sanitation, which can be attributed to your standard operating procedures, pest control, again, standard operating procedures and systems, and poor hygiene or food safety observations. Foul odors also make a huge impression. Internal data, there's a lot of areas inside the restaurant that we gather data ourselves, and we're not realizing that that can be used to make better informed decisions to improve our restaurants. Food safety assessments are done often in restaurants. Risk management is also recorded and tracked. Electronic or manual monitoring may also be done regularly. Claim reports and trends are a great data source, as well as supplier performance audits, workplace and guest risk assessments, guest suspect foodborne illness calls, employee turnover, and guest and employee satisfaction and survey results. What are the risks preventing us from being proactive? We see that gaps in standard operating procedures, poor monitoring systems, unapproved suppliers, and poor corrective action can all be risks within the restaurants. When we look at poor corrective action, the person in charge should have active managerial control. It's important to have up-to-date managers, certifications, and the knowledge to act and train and teach. Standard operating procedures must be in place. Effective training and updating these regularly are very important. Approved suppliers, certifications, and a partnership within your suppliers. Communication is very, very key, as well as on-site receiving logs from your suppliers. Poor monitoring also plays a role. Spend time to stop and watch behaviors. Review documents and take action. Don't just file them and put them away. Share and communicate. We look at that reactive culture and we move to a proactive culture. So as you use all the data that you receive, how do you build a strong food safety culture? What does it look like? Are you active and aware of the risks? Do you have consistent and high-performing health inspection results? And do you have a low risk to guest complaints and social media exposure? How do you access the data, and more importantly, how do you use it to stay informed and compliant? We ended to make sure that we had time for questions today. So I'm going to go ahead and hand it over.
Great. Thank you so much, Mandy. That was very informative. We have had just a couple questions come in. As mentioned in the beginning, at the top of the hour, you can submit your questions through the Q&A function in the lower right on the webinar. But let's just get started with one that came in. Is just kind of building off that last slide that you had, Mandy. With what are some things that you can do right away to shift to that more proactive approach?
Thanks, Karen. I think as you look at a proactive approach in the culture of clean in your restaurants, we think about training and something that you can do immediately. We know that training can sometimes take a long time and resources, but if you look at training, 70% of people learn best while on the job. I think that training is the most important thing that we can do immediately without putting in other systems, not looking at other data, working through, taking the time to train immediately on the job instead of having to schedule something and get everyone together. It can be done immediately within the restaurant. I think that's the key.
Well, just a follow-up to that, what recommendations do you have to make training at the store level more effective and efficient? What can people do to make sure that it sets in with people?
I think, again, it's the best practices that you learn through on-the-job training. You really have a lot of opportunities and data. You have a lot of opportunities to find data within your restaurant. You're getting them from so many places. And, again, I think it's really important on how you use it. We take that information for granted. Many restaurants or services can be information-rich and data-poor. So what are you doing with it? And we have an opportunity to make that training more effective and efficient if we know what it is that our opportunities are or areas that are key performing indicators and can grow our business. How do we grow sales? How do we reduce guest complaints within the restaurants, either from sanitation or pest concerns or foodborne illnesses? How do we keep our guests happy? How do we keep our employees happy? Those are all areas that we can look at that will make an immediate impact if we train everybody and share that knowledge, not only training effectively and efficiently, but telling the whys behind it. So at the store level, if you make that training short and engaging, and again, learning through working on the job, 70% of us learn through working on the job. That's very important. So I think effective and efficient training starts with knowing what to train and how people learn.
That's great, Mandy. A question that come in, I know it's not quite your area of expertise, but I'm sure when we talk about cleaning and sanitizing, you can help fill in some of the blanks here. Someone had asked about, fruit flies. They get, as a person who's going to a restaurant or in an environment, they say that they're really annoyed by them. Mm-hmm. And, why are they such an issue, and what can and should restaurants be doing to help reduce that issue, if not eliminate it?
Fruit flies can be in restaurants that have poor sanitation practices. So that is something that can immediately impact the presence of fruit flies. Many times you walk in and there are fruit flies, there is also an odor that accompanies it. So restaurants really have the opportunity to clean and sanitize better when they have fruit flies. It's a great indicator that you don't have clean floors or walls or drains. So one of the things you can do is put a regular cleaning schedule in place. If it's bothering the guests, it's most likely bothering the employees as well. So it's good to put those systems in place. You can use the proper cleaning chemicals and tools to use that to clean the floors daily. I found in my experience that having access to floors and drains is very important. Sometimes they're put in, poor areas to reach, so it's important to make sure that people have access to those. Taking them apart, so you want to take the covers off of drains when you're cleaning them, because that water and all of the debris inside of the drain can build up, and that's where fruit flies can breed. taking it off and having that access to cleaning it out properly with a brush and the chemicals and that action can help reduce the odor, the areas where they're breeding, and the fruit flies themselves, making sure that the cover is put on, obviously, so that it's not a trip hazard, and then using the proper tools and using them correctly to clean the floors. I think that if you are able to have that system in place, again, regularly, it's not just a one-time. I don't know the exact cycle, but I do know that that fruit flies can continue to hatch, so it's important to find the areas that they're breeding and clean them often, and a good schedule in place will not only reduce the fruit flies, but it will set expectations for everyone in the restaurant that we know when and how to clean properly, and again, it goes down to training and making sure that people know how to do it. But a clean environment definitely can help with the reduction of fruit flies.
Great, thank you, Mandy. Another question's come in about, sustainability and trying to be greener and environmentally friendly, particularly with the sanitizers. But yet, of course, there's, how do you find product approved for food service and what should they look for? What are some key indicators or things they should be looking for on the label to be environmentally friendly but yet be compliant? Now, when I look at all the,
this is an area that maybe we can get that person's information, have someone that has that chemical expertise with them, but just looking at the chemical itself, it's important to always look at the label. There are SDS that go with every chemical, which is a safety data sheet. It will tell you how to use it properly, the chemical properly, what to do if something happens, but most importantly, it will also give you insight to what you're looking for as far as sustainability within the chemical. I do know there are a lot of other things associated with chemicals that attribute to sustainability, such as water usage within the restaurant, so it's very important to look at that as well. So I would say not only the chemical itself, but what are some of the other effects of using that chemical within the restaurant. Hopefully that helps.
Great. One of the other things that you talked about a bit was social media. And, what would you recommend a restaurant should do, given that Yelp is, publishing health scores and people are self-reviewing on restaurants as well? Even though some of those health scores might be over 6 months old, and no one knows when the next inspection is due, what do you recommend those restaurants should do to kind of help with their social media and that kind of impression in the marketplace?
Right. Social media is becoming a huge area for people to gather information about a location. They might access it right immediately before they go visit or after they visit, and it gives them some insight, or it might give them false insight to what happened depending on what someone posted, which in a sense we do have a little control over because we can affect that person's visit. When we do receive a poor score on a health department, that's very unfortunate, not only because it's public information, and somebody may tell others about it if they do read it, but it doesn't show that the restaurant has a great culture of clean, and ultimately that's what we're going for, is the culture. So if someone comes into your restaurant and you had a poor experience or a poor score on a health inspection and it's posted, I think more importantly, to win that back over and improve your food safety of the restaurant to reduce the risk of foodborne illnesses, it's important to change your culture. If you really want to show someone that your restaurant is clean, that you have good food safety practices, it's really in person, not on paper, not on an app, not on what they read, but to make an impression, you really have to follow through on what you say you'll deliver. So if you want to look at how to improve and have people think differently by something that's been posted, is to just actually prove it, and it starts in the restaurant. when the health department does come back and there is that inspection, hopefully if you put that culture of clean in place, the score or the results will go up, which again, reduce the risk of foodborne illness, and it shows that you've taken that information and turned it into data, and you've really used it and improved your systems. I think it will help with guest satisfaction, employee satisfaction, which leads to turnover, and it'll help with everything that is posted and online. So even though you can't control what is put on, you can control what you do afterwards. It's unfortunate that you did do poorly and it's on, or that someone perceived that they had a bad experience, but what you can do is improve the next experience for that person and the next guest. Hope that helps.
It does. And just kind of building off of that question as a follow-up, what are some of the best ways for folks to measure their brand success or that improvement that you just talked about?
Right. That's a good one. So I'll go back to what we spoke about on the slides. And you talk about a reactive culture, and then you go to a proactive culture. So we know that a poor food safety culture can, and this is perceived again, but it can consist of critical and repeat health violations and high guest complaints. So that's an area that you can focus immediately to improve. Moving through, you can move to susceptible. Are you reacting because you have susceptible systems? Are you aware of what goes on, and are you active? That could lead to a proactive culture and proactive systems within the restaurant to improve. So unknown sources are an area that you can look at to have a key performing indicator of how you're going to do and what risks you have. If you have gaps in systems, which you may not always know, it takes time to look through your standard operating procedures. Ask the people that are following through and are using those procedures. They may be written and they may be posted somewhere, but they might not be applicable. They might not be practical, and people might not be using them because of that. So those gaps are important and a way to measure how you're doing. Inconsistent procedures can also be important. Corrective action, monitoring systems, but ultimately all those lead to measuring sales, operations, results. Again, guest satisfaction, employee satisfaction, turnover. There's so many of those risk points, even injuries, and guest claims and calls, employees' claims and calls. That information can tell you a lot about your systems and your environment itself. When you take pride in how well you're doing in those areas, and you have reduced falls and you have reduced guest calls and reduced illnesses or perceived, you really should be proud of that and communicate that, because those are areas that will show that you're doing well and your systems are in place and they're working.
Great. You know, one of the questions we hear, or that we often hear from people and here at Ecolab is, what do we recommend to drive supplier compliance? You know, you're doing everything right in your own restaurant, in your own facility, but you always have these suppliers who are bringing things in. How do you work on that supplier compliance and food quality, in particular with some of those local and small suppliers, which is a trend we see a lot right now in the food service industry?
Local and small suppliers, yes, they are a trend that's moving up in the industry. Large suppliers have more resources, or they may have more resources to work towards a certification and the resources to train and move forward with it. With GFSI, there is also a program called the Global Market Program. It's in place for suppliers to work on moving towards a certification, and it's specifically geared toward those small suppliers that may not have the resources or the people in place to move towards, to get that certification. So that would be a good area to steer suppliers toward. Also, working with suppliers, no matter how big or how small, it's important to have transparency. If you're not communicating with your suppliers, it's very difficult to know changes or when things are happening, such as withdrawals or recalls. Communication is very important. That's one way that you can improve that supplier's compliance and food quality. If you have that communication and you know what's going on within the supplier, and you can work together to improve it or fix it if it's an opportunity. So that transparency, encouraging the supplier to work towards certifications or using the Global Market Program are two ways for you to partner together with your supplier. And again, that's a partnership. Suppliers, they impact, if you talk about or you think about working in one restaurant and how that influences all the guests. If you take that and you magnify it, that one supplier may touch multiple restaurants. So then you magnify how many people the one supplier impacts, and that's a big number to think about. So when you're talking about farm to fork, having a good relationship and communication with your supplier is important for food safety and for quality in your restaurants and the end user.
So just to wrap up, I'm going to just ask one last question,
okay.
Mandy.
Yeah.
And so just, people have their standard operating procedures in place, but they still struggle. What is just like one, maybe two things they can do to overcome that obstacle?
To have the systems in place is first of all, that's a great foundation. Sometimes it's difficult if you don't have those systems or it is difficult if you don't have those systems in place. So you have to have the standard operating procedures. But if we're still not able to execute them, I think the one thing that you can do right away is make sure that they're correct, make sure they're practical, make sure that they're applicable within your organization. Are they written correctly, and can they be executed correctly? And the next thing, the second, probably one of the most important, is to make sure that people know how to execute the SOPs. Just because, again, that the standard operating procedures are written and they're in place doesn't mean that people necessarily know how to execute them. And third, which is often and very often missed, is the corrective action. Praise when people do things correctly. Encourage people to do that again, and make sure that there's corrective action in place if you're struggling. So knowing that you're struggling is important, and having the standard operating procedures in place is important. And if you know that and you have the procedures, you have to make sure they're right. And you have to make sure you do something to communicate how to execute them and how to improve and make a corrective action if people aren't following through with the procedure and you're still struggling.
Great. Well, thank you so much, Mandy, for your time. I think you still have control, so if you could just flip to the next slide for me. We can do just a couple wrap-up notes. First of all, thank you, everyone, for joining today. We have recorded this presentation, as we said at the top of the hour, and so that will be available on ecolab.com right around February 12th. We also have our next webinar. We're still working with our speaker, Dr. Ruth Petron, on solidifying the date, but it will be in May. Her topic is going to be the impact of food service industry trends in food safety. So she's going to look at some of those emerging trends that we talk about and provide some insights on how to control and be a little bit more proactive of these emerging trends that we've seen, as opposed to things that we kind of know are happening today. And like I said, we'll watch for that in your inbox. We'll have some more details of that in May, early May. We've had a couple questions that came in about CEU credits. We will have those out probably in about a week. We had a few technical difficulties on our website, so we haven't been able to upload them and send out a link. So we might get them kind of kick it the old-fashioned way and have them out via email, but we'll probably do that within the next week or so. The other question we often get is a copy of the slides. As mentioned, the presentation will be available online, but if you're interested in having the slides and you drop us an email, we can get those to you. If you could click to the next slide, Mandy.
Absolutely.
So a way to help us make sure that you get those continuing education certificates is at the end of this webinar, there's a survey that pops up, and one of the questions is, would you like a continuing education certificate? So if you click yes on there, that's how we know. You can also, as I said, always send us an email, and we can get that to you as well. So again, if you click to the next one, Mandy, I think. Thank you very much for joining us today. And Mandy, thank you very much for presenting. Your insights were very valuable to everyone, I'm sure. And we look forward to hearing from and presenting to you all again in a couple months. So thank you very much for attending today, and have a great day.